item on the agenda is non-public. Do we have a need for a non-public session?
Madam Chairperson, we do RSA 91A3, Roman numeral 2, lowercase a, dismissal, promotion, compensation of public employee, and lowercase c, reputation.
Okay, thank you. We have no minutes tonight. First item after minutes is public hearing. The Wolfeboro Board of Selectmen to consider a temporary event permit for Brewster Academy to host a cross-country running race on September 29th, 2021 from noon to 6 p.m. at 390 Pine Hill Road, which is Amanacki ski area. Is there anybody in the audience who'd like to speak to this event? Okay, I'm going to open up the public hearing. I'm going to close the public hearing. Board members, I had a conversation with Christine just a little while ago. This is the same course over at Amanacki where we are having construction. We have denied Kingswood High School use of this area due to the construction, but I'd like to hear from board members on what they'd like to do.
I think that makes sense.
Yeah, I completely agree with you, Linda. We said no to Kingswood on 2 events there. I think we have to, kind of have the air, then consider it next year.
Okay? Is everybody in agreement with that? So if that's the case, I need somebody to make a motion.
Make a motion to deny temporary event permit for Brewster Academy to host a cross-country running race on September 29, 2021 from noon to 6 p.m. at 390 Pine Hill Road, Amanacki.
Do I have a second?
Second.
Any further discussion? Hearing none. All those in favor?
Aye.
Opposed? Next item on the agenda is public input. Is there anybody in the audience who'd like to give us public input? Hearing none, we'll move on. We do not have a bulk vote. We do not have a committee appointment. New business, emergency repairs, Effluent Pond Public Works Director. Mr. Ford, are you here?
I believe he...
Yes, he is. We will just hold up for a minute. We'll just hold up for a minute here, and
It's almost the same.
you're ready for you.
See the amounts. Thank you. I hope.
Dave, can you flip the mic on?
Love to hear what you say. Hear me? Okay, I'm here to speak about the effluent storage pond and the catwalk that we had fail on us about a month or so ago. Disconnect the discharge into the pipe and relocate it so that it's safe and we can keep it there for at least a year, if not longer. The catwalk itself is still in danger. It did shift again and broke a little bit more. We had a diver come in, take a look at it, and at this point we think it's going to be a salvage operation, at least for all the steel. Some of the piers, we might be able to cut them off and scab something to them to put a new catwalk on, but right now it's a salvage operation. The other thing we have to do is at the end of the pier we have a connection to the intake, and we have to get that anchored before we take this other one down. So we're probably going to try to put a temporary float, anchor that to that as we take the structure down. What we did originally under the emergency, we used authorization from the cap reserve fund. And we've spent the money, it's shown in here, about $48,000 either spent or committed. That fund is limited, and it was specifically for upgrades at the plant. We have additional funds that has been received by the town, the ARP funds, and what I'm requesting now is to use those funds to finance or to authorize to fund the second page. And hopefully, most of this will be reimbursed by insurance. Right now, Primex is doing the investigation. I talked to the adjuster earlier this week. He says he believes it is a claim that will be paid, but how much and when, but we can't wait, because if we wait too long and it freezes, then we have it complicating and more potential problems. So what we're looking for tonight is to continue forward with the operation for a salvage operation and stabilize it for a period, at least a year or so, By then, we can get that out of the water, we can draw the pond down, and then we can come up with a long-term solution, whether we rebuild what's there or whether we improve it with an alternate location. So I'll answer any questions if you have any on the memo or the cost.
Just a clarity, I was looking at the computer. Are you saying this emergency fix will last a year or two, or just a year and then you're going to change it? Because we still have not gotten okay on the RIB site, and the last time I looked, the pond was pretty full.
Okay, I should have mentioned that. So a couple things about the RIB site. Next week, we're going to get substantial completion, and October 1st, we're going to start up the RIB site. So we're going to start discharging next week, and we're going to start at a very slow rate. The pond, we have brought it down, and we have it under control, and we still can spray for the rest of this month. So at this point, we feel that the emergency or the concern about the pond overspilling, we have that under control. So we're backing off the spraying now for October, and RIB starting up, we'll be able to maintain it, and then over a year, we'll slowly bring it down. The discharge can stay there, it's solid, it's not a problem, and that can stay there but what it is we got into the dam, we moved it 20 feet over, and now it's discharging onto horse mats on the stone, and as the pond comes down, we extend the horse mats down, and we have them anchored, so it's kind of a Yankee solution, but it should work, get us the time we need until we can get the long-term solution.
Any other questions from board members? So we're going to get the work done now in order before we freeze, and that's why you're asking us now, and we're okaying you to use the ARP funds that we already have in our checking account.
That's right. We received the check, I think, a couple of weeks ago. We got half of those funds this year. It is for work related to the wastewater treatment facility, so it qualifies. We'll have to put this in on our report. One of the things that might happen is we may get reimbursed before we have to do the report, so this money authorization may end up being not necessary because it'll be the insurance, and then we can use the ARPA funds for another project. But right now, before I can contract with someone, I got to have the authorization. And the next step, I have to get the engineer to design the footings for the crane, and then we got to build the footings, and then have the crane come up and then pick the catwalk up. So that's what we're looking at now, and each thing takes a couple of weeks, so we got to start now so we can get it done before.
$1,103.
Yeah, I usually don't get exact like that. I must have been tired, but usually I would round up to say 130,000. So
You want 128,200? You want us to go up to 200 instead of the $3, or you want us to go back to the one? I just need a figure for the motion.
It's what I asked for is fine. I'm laughing at myself because I usually don't get to the dollar sign. But as you see, there's contingency in here, and it's really a moving target. So that should be fine. The way I've asked for that appropriation would be great, or authorization, I should say.
Any other questions or concerns by board members? Hearing none, does somebody want to be brave enough to make a motion? If not, I will try. I move that we authorize the Public Works Director to spend $128,103 from the ARP monies that have already been deposited in the town's checking account.
I'll second that.
And Brad will second that. Any further discussion? Hearing none. All those in favor?
Aye.
Aye. Opposed? You have your authorization.
Thanks so much. And we'll track it. I'm working with KC about getting account numbers and making sure we meet the reporting requirements. Thanks a lot. Appreciate you taking on short notice. Anything else? Any other questions for Public Works? You're all set right now? Good there?
No?
Like I said, good news on the REB. Next week, substantial completion. So that is good news.
Oh, I have one question. How's the timeline doing for the paving of Railroad Ave?
I've run into a little problems with supply of materials. We're still hoping for the mid-October, so which is coming quickly, which is 2 weeks. So maybe mid to late October. But hopefully by the end of October. So let's say Halloween. Wait a second. How about November 11th? Well, that's a good date. Veterans Day. Veterans Day. No, wait a second. How about Thanksgiving? It'll be done before the end of the year. And I guarantee.
Yeah. Okay. Next item on the agenda is the Pop Whalen COVID policy, and I think we have our Park and Rec Director here for that.
Yes. So the last meeting, I gave you just a handout of what we have kind of proposed. I did have some conversations with Linda, who has grandchildren in the hockey program in other areas, and I have talked to other people who've been to other hockey rinks. It seems that most hockey arenas are allowing each organization to decide what they want to do when they come into the rink. So I feel like this might be a little aggressive. I think we can pull back a little bit. Having a conversation with Linda, one of the things we talked about is maybe 12 and under in the locker rooms and on the ice where they're so close. The ice, they could have that shield, and in the locker rooms, they should have a mask. And then we will still allow the 60 spots. I have circles that we'll put all along the rink and on the bleachers. We'll leave open the lobby because that's really where people are entering, exiting, and using the bathroom and going to the locker room. So we want to keep that space free from people without masks. And I think that's it. Yes.
I would ask that you keep in close contact with schools.
Yes.
And see how they're doing, because I know that the elementary schools, they're starting to have some cases pop up in 5, 6, 7, 8, 9, 10-year-old kids. And I think that would be a good barometer of how the teams are going to be.
Yes, agreed.
Yeah, I thought that was kind of what we were trying to do, and that we're looking at substantial spread and high spread. We'd have this policy, the school system's going to remove the mask if it's moderate and low, and that we as a town should follow as best we can the school district. I've had numerous conversations with Christine. I did read that Bedford High School had 32 cases, and they are requiring masks whether you're vaccinated or not. Dover, they've already had 3 adults and 4 players. And, you know, it's hard. For a while I was thinking 17 and under, just deal with kids and leave the adults. But really, anybody at 12 and older can have a vaccination if they want. It's hard because there's so much feeling on one way or another.
Well, now it's actually 5 to 11-year-olds can have the Pfizer.
I don't think that's been approved yet.
Wasn't it approved?
No, I think they said it worked on them, but I haven't heard any approval of it.
So what I'm hearing, is that we wouldn't have a mandate mask wearing. It would be suggested for adults. Is that correct? Is that what the interpretation is here?
That was what I was thinking. The only required or mandate would be 12 and under, and when they're also on the ice and in the locker room, and that means parents. And then everything else, we highly recommend that they wear masks, but we're not going to mandate. Was kind of where I am, but please jump in, everybody. That's just my idea. I have struggled with it. Bounced all over the place on whether I wanted this or that or the other thing, because I want to protect the kids, but, you know, we also don't want to have a big issue.
Right.
It's my other self.
And last year, when we were ready to open the hockey rink, once we came out with all our COVID protocols, that's when all the hockey rinks were shut down. Because we are not a year-round rink, we're just getting started, and they've already been in it for a few weeks. So that's why I did want to have something in place, just because we knew it could change by the time we opened.
And at the Dover rink, the Hockey Association is requiring the teams to quarantine for 10 days. And my feeling is we send that over to Back Bay Hockey, and they can decide what they want to do. This is my idea. They can decide what they want to do about their teams if they have outbreaks on their teams. Brad or Dave? Me?
Yeah, I'm good with that. I think, definitely stop short of mandating it, but, for younger kids, that's good to have them either shielded or masks on during ice time in the locker room, and play it by ear, and, go with the, I like Brian's idea there, monitor the schools and get updates there, and kind of see how it goes here as the season comes along.
Mm-hmm. Dave?
You're talking about the clear shields on the helmets, that you would require every one of the players to have that, and not just the cage?
Right, that's what we did last year. Yep, just the
Okay.
clear shields, yep.
That's fine.
And that was the U.S. Hockey was the ones who recommended that as a possibility last year.
And Linda, you were right. Pfizer is filing for emergency approval, but they haven't got it yet. And I know that when Carpenter School started the year, they had 0 cases, and I think now they're somewhere in the 3 to 6 case range. So it's just something to watch as we go along.
And I think if Christine, if there's an issue or an outbreak, we may need to address it in a different manner. Are we all in agreement that these are the steps we want to take?
Yep.
Somebody want to make a motion?
I'll move that we approve the regulations that were brought to us by the Parks and Rec Director.
Do I have a second?
Second.
Any further discussion? Hearing none. All those in favor?
Aye.
Aye. Opposed? Okay, Christine, thank you very much. Okay, next item on the agenda are the agencies, and we have a packet. It's a budget hearing 2022 social service requests. And the first agency is V&A Hospice, and we have somebody here. Come up to the mic, please state your name for the record.
Hello, I'm Brian Winslow with Granite V&A. I'm here this evening to request $22,000 in support from the town of Wolfeboro for our home care, hospice, and pediatrics programs. If you'd allow me 2 or 3 minutes to talk a little bit about Granite V&A, then I can answer any questions you might have. Granite V&A is a new name. You may not really recognize Granite V&A. April 1st, Central New Hampshire V&A and Hospice and Concord Regional V&A merged, and we became Granite V&A. It's important to know that Granite V&A will continue to offer all the quality program and services that we have offered and provided to Wolfeboro for over 100 years, going way back to when we started as a Red Cross visiting nurse agency. To talk just a little bit about that merger, very briefly, it comes at a very important time in healthcare. There are many benefits to merging these two agencies, but I'll talk about one in particular, and that's the increasing of the depth of our staffing, both in numbers and in expertise. I don't think I have to share with anybody here tonight the staffing issues that we're having across New Hampshire in all sectors, but healthcare particularly. So I think that merging and coming together in April while we're still in the middle of integration has helped tremendously over the past couple months, because we have been able to draw on a lot more staff and experts than we have either organization would have in the past. So I wanted to point that out specifically. Two other additions that Wolfeboro may notice in the future. Granite V&A now actually has direct access to a hospice house we didn't have direct access to before. In merging with Concord Regional V&A, part of that organization that came with it was a hospice home, so that's really good news. And in addition to that, we actually, Concord Regional V&A had a well-developed community benefits program where they offered a lot of community education, a lot of clinics, a lot of educational programs and teachings in the community, and we're hoping over the next year or two to be able to offer a lot more to Wolfeboro. So in addition to our normal, and I like to say high quality because those nurses are great, the normal programming that we've always offered, we're going to be able to add that. So I know you have packets. I'll quickly summarize. In Wolfeboro last year, we made 6,021 visits to 424 residents of Wolfeboro. And in doing that, we were able to provide just a little over $46,000 in charity and free care. During all of that provision of service, as you can imagine, we were greatly challenged with the pandemic. I hope you noticed that the volume did not go down very much at all. We stayed busy. We continued to go out and visit all the clients that needed us to be visited in Wolfeboro. I should note that at the very beginning of all this, everybody was pretty nervous and people didn't want us coming into their homes. That changed pretty quickly, and especially when we started adding some of the COVID services that we added. We actually worked really closely with, I have to get my glasses on to read this part, guys. We did partner really closely with Carroll County Public Health, and in addition to all our regular services, we were actually able to both test and offer vaccinations. And we actually did so. We provided 428 doses to 214 individuals. And those individuals included staff, included volunteers, included community members, but certainly included patients. And we partnered with other organizations and other VNAs actually to provide them with COVID vaccinations because they didn't have the capacity to do so themselves. With that said, specific to Wolfeboro, we actually piloted a program with the New Hampshire Department of Health and Human Services because there was no provision to go out into the home for individuals that couldn't get out, whether they were patients of ours or not, that couldn't get out to some of these vaccination sites and provide vaccinations. And the state didn't have any provisions to do that. They asked us to pilot a program to do so, and we did that right here in Wolfeboro. We started it, and it worked out quite nicely and was able to spread throughout New Hampshire so that we were capturing everybody that really did want to get vaccinated. Those are kind of the stats, and very quickly what went on over our last fiscal year. I know the packet is much more in depth, but if you have any questions, that's really what I'm here for.
Board members, anybody have any questions or concerns? I'd just like to thank you and your agency for all that it did for this community through the COVID and how you take care of our residents who need that kind of help. And our $22,000 should go towards that 46 that you were unable to collect. And so thank you. Any other board members?
So I will end with this. Thank you for your appreciation. I will take all the credit, even though I'm not the nurses that actually do all the work. But I will pass that along to them because it does mean a lot that their community does care. So, well, thank you guys.
Thank you for coming tonight.
My pleasure.
All right. Next item, next agency on the agenda is Meals on Wheels. See, do I have anybody here from Meals on Wheels? Well, why don't we skip over Meals on Wheels, maybe they will come shortly. I think we told some people to come at 6:30. I do see that we have online is the Tri-County CAP, and is there somebody who's on who'd like to speak to us? Will you give your name for the record?
Hi, that would be me. Hello, everyone. I'm Jeannie Robillard, the CEO of Tri-County CAP, and I have with me Amy Goyette, who is the Strategic Initiatives Director for our agency. It's good to be here with you this evening. Thank you for the opportunity to attend virtually. We really appreciate that. This is our second year of changing up our requests a little bit. We are now asking for municipal funds from all the municipalities that we serve on a formula basis. This year, we are asking Wolfeboro for $14,450, and that's on a per capita based on population, so that we've sort of leveled the playing field among all the communities that we serve, so that, in an effort to make things fair and equitable for everybody. Last year, we provided services to 375 households for a total of $306,044. That's not including the NEREP program that we've been running this year. That would add about an additional 82 households and close to $125,000 for this year alone, this fiscal year, that we've been running that program to Wolfeboro residents. Part of the other reason why we do a formula is that, in the past, we have asked communities for, one program or another program, for municipal funds to support that program. But the truth of the matter is that most of our communities, we are running lots and lots of programs. For instance, in Wolfeboro, we offer energy assistance and fuel assistance. We have transit services, weatherization. We have the Tamworth Dental Center, which is now known as Tri-County CAP, family dentistry. We also have homeless intervention. We had the HRP housing rental program, which was rental assistance through COVID. And we also do USDA food delivery, and the agency in Wolfeboro that we pick up food and make sure that it's distributed to them is Life Ministries. Last year, we provided 2,512 boxes of food to be distributed in Wolfeboro through that agency. Like the other gentleman said, COVID's been tough. It has been a tough year for everyone. Tri-County CAP never closed its doors, not for a single day through COVID. We knew that the people who needed us the most needed us even more through COVID. And municipal funds are a really important part of that equation, because many of the federal and state dollars that we're able to pull in to Carroll County to support the communities have to have match dollars. In other words, they might give us 80% of a project total, and we have to come up with the other 20% from unrestricted funds. And that's where municipal funds play a really, really important role in our ability to continue to provide services to folks. I think that's it, unless Amy has something that she wants to add.
Is there any selectmen have any questions that you'd like to ask? I don't hear any. Thank you very much for coming and providing your service to our community.
Thank you. It is a pleasure. We love to serve. We're very, very pleased and proud to be a part of the fabric of Wolfeboro and of Carroll County.
Okay, thank you. I'm going to circle back. I see that somebody from the Meals on Wheels has joined us remotely. So this is Meals on Wheels. Cheryl?
Muted. Oh, there we go.
Good.
Let me see if I can turn my camera on. Or maybe that's not allowed.
No, you can. You probably just haven't hit the button.
Let's see. Oh, I see. I see what the problem is. There we go. Hello.
Hello. We still,
Can you see me?
we still can't see you, but you're welcome to continue. We just need you to state your name for the record so the secretary can add it to our minutes. So.
Okay, Cheryl Dempsey, representing Wolfeboro Area Meals on Wheels. I'm thrilled to be able to participate remotely and thank the town for their past support of the Meals on Wheels program. Our request this year is for level funding as has been requested by the town. Our meal deliveries are up. We have a higher demand for our services. Wolfeboro comprises just under 70% of the clients served. We also serve clients in Brookfield and Tuftonboro. I'm happy to entertain any questions if anybody has a question for me.
Does any board member have any questions for Cheryl? I found it interesting that on your income statement that you have gotten a significant donation from an estate, and it's nice to see that your agency is in the black.
Yes, that was quite a surprise for us, and we were thrilled to have that cushion. Yes.
Yeah. Well, I don't hear anything from any other board members. I want to thank you for the service your agency does for the town, for all those people who can't get out and who gets a a meal a day from you. So thank you.
Thank you, Linda.
Okay, next agency is the Wolfeboro Area Children's Center.
Good evening, and thank you for allowing us in person as well as remote to be here. I am Terry Ann Cox. I'm the Executive Director at the Children's Center right down the road. I think this esteemed group of people know how important the Children's Center is to our ecosystem here. We are a child care facility that's providing affordable, high-quality child care and early education. We're really the only facility in the area. A lot have closed, unfortunately, because of the pandemic. There is the reopening of Magic Moments, which is a preschool lab environment at the Lakes Region Technology Center, and also, of course, Wolfeboro Nursery School. But we are a facility that serves infants ages 6 weeks through 12 years of age. And our enrollment is back up. And unfortunately, we do have a significant wait list right now, particularly with after-school programming because of our stress and lack of staffing. We're continuing to look for part-time people that will work from the 3 to 6 o'clock time frame. But all that said, I am here to respectfully request level funding once again. The Wolfeboro families do account for about 50% of the families that really find fully paying their child care beyond their reach. And the town has been able to support us year over year, and we are grateful for it. Last year, 37 children were the beneficiaries of the town's support. So I won't really go into any details unless there are any questions that came from the information that was submitted.
Board members, anybody have any questions or concerns? Thank you very much. This is a very needed facility and agency in town, and thank you for taking care of our children so well.
Thank you. Thank you so much. It's an honor. Thank you. Have a good night.
Next agency is Life Ministry Food Pantry.
Good evening. My name's Mike Turner, and I'm the president of the Life Ministries Food Pantry. We're a 501c3 nonprofit organization established 36 years ago by a group of area churches. We are governed by a 20-member board of directors and run by 60 volunteers. Our mission is to supply or provide 10 meals per week for each family member who qualify for our services. Last year we distributed 208,000 meals, which was about a 4% increase over 2019. So far in 2021, we distributed a little over 100,000 meals. So from your standpoint, 31% of our total clients in 2021 are from Wolfeboro. The number of Wolfeboro individuals currently being served is 176, of which 56 are children, 56 are over the age of 60, and the remaining are between 19 and 59. So thus far we've distributed 33,462 meals to Wolfeboro residents. Our current food budget for 2021 is $165,000. We've been fortunate to have received monetary support from our community as well as various foundations this year. The New Hampshire Food Bank continues to provide us with food supplies at a low cost, and obviously used local groceries to supply us with food that we can't get from the food bank. We actually ask you for the same fundings that we received last year, which is $15,000, which is only 9% of our total food budget, even though 31% of our clients are from Wolfeboro and receive 33% of the meals distributed. I want to thank you for this opportunity. I want to take this opportunity to thank you for your kind help in the past, and our clients, our board, and our volunteers. I really appreciate it. So have a good night, gentlemen. Thank you.
Thank you. Board members, any questions or concerns you want to Again, I want to thank your agency for helping feed our area families. Thank you. Next agency is Starting Point. Is anybody here from Starting Point? Okay, I didn't see any application go in. I'll move on to the Kingswood Youth Center.
Good evening. I'm Zachary Porter with the Kingswood Youth Center. We had an awesome year this past year at the Youth Center, so thank you so much for your support in making that possible. Things have been different amidst the pandemic. However, some of the bright side of those differences is we believe our services have been deeper and more impactful than ever before, and we've also been able to increase our hours of services. So in typical years past, we would offer about 500 to 550 hours of service a year. We were able to offer roughly 636 during the previous 12 months. Just to refamiliarize you with our major programs in brief, we have 5 major programs. Our long-standing after-school program, free to all Governor Wentworth School District students interested in participating. We have our BTAS program that's beyond the after-school, school vacations, extended hours in the evening, and some weekends. Summer programs. This summer, we did more than ever before, and we also had better attendance than ever before for the summer, which had been a goal of ours for a long time. Years ago, we didn't do much in the summer, but these past 4 summers that has changed, and we really flourished this past summer in that program, which was wonderful. Full day and half day programs really just got the students a prolonged, in-depth experience to engage with one another and to explore resources in our community. A lot of time outdoors, as well as some time at the center as well. We have our Club 121 individual mentoring program. That program connects students at Kingswood with adult mentors who work one-on-one on goal setting, planning for the future, emergent interests, and really connecting the mentees, the participants, with resources, support, and encouragement to promote their short-term, midterm, and long-term success. During the previous school year, we also, under that umbrella, we did a lunch and learn program. So while schools were remote and hybrid, we did open our center up during the day for assistance with schoolwork, as well as a free hot meal. And we're really pleased that the students are back in school full-time, and the students and the parents are very pleased about that as well. So we're happy about that, and what we've done is now we've taken that time and we're doing even more evening hours. In the last program I'll quickly highlight in this summary is we have our KYC cupboard. It's our own free food pantry. It was originally just kind of a additional support that we were doing during the really the heavy shutdown period at the beginning of the pandemic. But the feedback and the utilization of that resource was so tremendous and overwhelmingly positive that there was no way we were going to pump the brakes on that. If anything, we've actually since expanded it. So in the previous 12 months, we distributed roughly 30,000 pounds of food to families, low-income families in the Governor Wentworth Regional School District. During the last school year, 28% of our participants came from the towns of Wolfeboro. We also received last year and have again requested funding from the towns of Ossipee, Tuftonboro, and New Durham. Again, thank you so much for your long-standing support of our program, and I'm more than happy to address any questions about our programs or about our appropriation request, which is for level funding in the amount of $5,000.
Any member of the Select Board have any questions, concerns? Thank you very much for your agency taking care of our youth in the town and providing them a place to go.
It's a pleasure. Thank you.
next agency is Northern Human Services. Somebody here from Northern Human Services? Northern Human Services. That Children's Unlimited, is that Northern Human Services? Nope, that's not.
No.
I don't see, well, I've got a caller. Northern Human Services? All right, I'm going to move that one over. I have senior meals. Somebody here for senior meals?
I know her.
Good evening. I'll put on my senior meal hat, but before I do that, most of you know, but other people might not know that I'm the welfare administrator for Wolfeboro. So I work with many of these folks on a regular basis, and they did do wonders during COVID and stepping up. Meals on Wheels took on all our senior meal clients, so they had an increase there. You will see a reduction in my welfare budget this year. Tri-County Community Action Program handled all the COVID funds from the state of New Hampshire. Were amazing, had turnarounds for all those payments very quickly, so thank you to them. And thank you to the rest of you. So, senior meals though, hasn't been running since May when COVID started. We won't be opening up back at All Saints this year at this time due to COVID. We are going to run an experiment. I did get some new board members and some new thoughts and ideas, so we're going to try to run a luncheon in October out of Amanacki using throwaway utensils because there isn't a dishwasher there. So right now we're asking for level funding. However, I might change that request in 30 days.
Okay, board members, anybody have any questions and concerns? Well, thank you, Amy, and hopefully we can get our senior meals up and running again.
Hopefully. Thank you.
All righty. Why don't I move over to the dinner bell right now?
My name is Bill Peterson. I'm the rector at All Saints Episcopal Church, and we host a number of these programs, as you are aware. And we took on Dinner Bell as the administrator 8 or 9 years ago as a church, and essentially our budget is twofold. We have a person that we pay to cook, and that's about what the town contributes on an annual basis. And then we put a plate out each week, and that and whatever is not met by that to cover food cost is covered by the church itself. Last year was the first year in my 7 years that we had a surplus, primarily because we pivoted from in-person dining to takeout dining. And so the offset in hot water and soap to run the dishwasher was more than eaten up by paper products and bags and things to do takeout. We continue to be a takeout facility. We gather in the parking lot to distribute those meals, and as many conversations have moved from indoors to parking lots, that has been the case as we've kept track of our people throughout the last year. We look forward to gathering indoors again and request respectfully level funding for the coming year. Any questions for us?
Any board members have anything? Thank you for doing that for the town and being our physical agent, and thank you very much. All right, next is the caregivers of Southern Carroll County and vicinity. Is there anybody here from caregivers?
Yes, I hope so.
Okay, hi Barbara.
Hi. Okay, good evening, and thank you for the opportunity to present our request. Caregivers of Southern, is there a problem? Caregivers of Southern Carroll County is a 501c3. We're an all-volunteer organization, and as you may know, we provide transportation to medical appointments for those in need in Wolfeboro, as well as Alton, Tuftonboro, and Ossipee. Our volunteer coordinators take the calls and arrange the rides with our volunteer drivers. Clients are never charged for our services. Our drivers are reimbursed at 45 cents per mile only for round trips over 50 miles, and most of the local trips are for Wolfeboro residents. Our reimbursed trips may go as far as Concord, Manchester, North Conway, Dartmouth Hitchcock, or Portland, Maine. And our services do help clients to remain in their own homes, having this transportation available. We have no real overhead, and we rely entirely on donations. About half of our donations come from the 4 towns that we serve. The other half come from individual organizations and individual people. We usually ran a surplus, but by 2019, due to the increasing demand for our services, our income was actually starting to fall short of our expenses. However, of course, there was COVID. And in 2020 and 21, we had to suspend our services a few times with certain exceptions. And this year, like last, our expenses for reimbursements have decreased. However, our income from a number of donations outside of the towns have also decreased. And with respect to Wolfeboro, Wolfeboro typically accounts for about half of the reimbursements we pay out each year. This year, through the end of August, we had 13 reimbursed trips. 12 of those were for Wolfeboro residents. And for 2022, we are again just requesting level funding with the prior year, which was $4,500. And we do appreciate the taxpayers' support for the services that we provide. Thank you very much. Are there any questions?
Thank you. Any board members have any questions? Well, I want to thank you and your agency and all those volunteers who help so many individuals out each year. So thank you.
Thank you.
Next one is CASA. Anybody here from CASA? I don't. CASA? Next item, next agency is 68 Hours of Hunger. Come on up.
Good evening. I'm Eileen Levitt, one of the 3 co-coordinators of N68 Hours of Hunger, and Carol Simpson. Louder?
Yeah, there you go.
I can be loud.
Yeah.
I'm Eileen Levitt, one of the 3 co-coordinators of N68 Hours of Hunger, the Wolfeboro chapter, and this is Carol Simpson. Our third partner, Jan Brooks, is unable to attend this evening, so we are here. First and foremost, I want to thank you for all of the support that you've given us over the 8 years that we've been in place. And in particular, this year, I need to thank Amy, who worked with us so hard on our one fundraiser that we had in August to try to get support for us at the gazebo. And we had, over the course of 2 weeks, 2 different major fundraising entertainment issues planned. Between COVID and the hurricane, we didn't succeed with either. However, we had a very successful raffle because we have so much support from the community. So this past year has been, with the pandemic, so completely different, but it also allowed us to achieve some goals that we had never had before or never succeeded with before. The Governor Wentworth School District stepped up with us and helped with the transportation of the bags to school, and that had made a huge difference. And also the school district was having a program that fed the remote and hybrid program children. So we went from 120 children to feeding 200 children across the Governor Wentworth School District. And it also allowed us to feed children in the summer, which had been a long-time goal of ours, but we were not able to access the same number of children during the summer programs as we were during the regular school year. So you'll see that we actually were feeding more children. We fed 33 children in Wolfeboro, and at $13 a bag, which provides 3 dinners, 2 breakfasts, 2 lunches, and snacks, the total cost was $22,308. We fed from March until June. We packed food for 17 students at Carpenter School on average and 16 at Crescent Lake. So at Carpenter, we packed 1,088 bags, and for the kids at Crescent Lake, 1,024 bags. And the cost of a bag of food at the current time is roughly $13 a bag. We are finding that food prices are going up, and we're finding some challenges in not always having the items that we have in stock. We had no major fundraiser during the course of last year except for our annual donation letter, and most of our monies come from the community, from donors. All of the money goes to the program. We're a complete volunteer program. But we do ask each of the towns that we serve for a donation. And so we thank you very much for everything you've done for us in the past. We are asking for another $1,000 this year because our total estimate for next year is $117,624. $117,624. Too big for me to say.
Yeah.
Does anyone have any questions?
Board members, any questions? Well, I want to thank you for feeding our children
It's an
and
honor.
all the hard work that you and your volunteers do.
Thank you. It's an honor to do it.
Okay. White Horse Recovery.
Thank you. My name is Mitch Yett, and I'm the CEO and founder of White Horse Recovery. We're based in Ossipee at 68 Route 16B. When we started White Horse back in 2015, we set up as a substance use disorder provider, so it was called White Horse Addiction Center. But over the next 2 or 3 years, what we learned was that mental health was a huge issue in Carroll County and in the entire state. So we made a decision to re-credential White Horse and add mental health treatment to it also. So we now do substance use disorder and mental health, so we offer full services. So we went from having licensed alcohol and drug counselors and master licensed drug and alcohol counselors to now having licensed clinical mental health counselors and licensed independent clinical social workers. So we are fully staffed to handle all. The other thing that we saw was there was not a lot of service for children. So we also re-credentialed and expanded our service to handle children age 6 and up. So we have a pretty wide service offering now. The other thing we did was we opened resource centers. These resource centers are walk-in centers that anybody can come into anytime. We have certified recovery support workers there, and we have recovery coaches. Those resource centers last year, in the middle of COVID, were CAPRS credentialed. It's a council accreditation for peer recovery support services, so we are nationally accredited. We did that and managed to pull that off during COVID, which was a challenge. So in what we do, we see about 260 to 300 clients a year. Our resource centers see about 3,000 walk-in visits a year. In our 2 locations, we have locations in Ossipee now, in North Conway. Wolfeboro is the 3rd highest group town sending people to us. So the 3rd most amount of clients come from here, from this area. We're projected this year, we're also we take people regardless of ability to pay. So we take Medicaid where most providers won't. We take them on sliding fee scales, so we have people who might only pay $5 to come visit us. Our cost per service unit is about $246. That's for, it could be 15 minutes, or it could be 3 hours. It depends on the program and what they're doing, but any engagement is considered a service unit. So we're at $246. Last year and projected this year, we're going to be around 2,700 units of service that we've provided. So my cost just on my clinical side this year is projected to be about $600,000. And out of that $600,000, we'll be reimbursed about $271,000. So we're about $322,000 short. Now, it sounds, well, how do you operate like that? Well, we operate on grant funding also, and we operate on private funding. So we have private donors and grant donors that help bridge that gap to keep us so we can operate. Wolfeboro will cost, this year we'll see about $43,000 worth of services for Wolfeboro, of which will be reimbursed approximately $23,000. So we're about $20,000 short here. Our ask of Wolfeboro this year, and this is the first time that we've been in here, is $10,000. And that's just based on half of what our gap is and what we're missing. The county gives us some support too, so that helps bridge the remainder of that we're out there, but we're still short. And that's, again, that's only on the clinical side. That doesn't count the resource centers and the funding that we put into those. The resource centers provide everything from food and clothing. They also provide case management. They provide the support workers. We provide shower, laundry, and things like that to people, in particular to homeless people or people that are just couch surfing or whatever they're doing. So we help take care of that also. Are there any questions or anything I can answer for you?
Board members, any questions or concerns? Thank you for presenting this to us and doing the work that you do, particularly in mental health and addiction. We will get back to you.
Yeah, I don't know if I mentioned too, we do 24/7 peer emergency support to Huggins Hospital and to Memorial Hospital. So that, in other words, if they have an overdose come in, they can call us 24 hours a day, 7 days a week. And we respond as certified worker to that location to help support that. So we do that, and we also work with the Kingswood Youth Center. We do Prevention Wednesdays with them.
Okay.
Thank you.
Thank you very much. Last one on the agenda is Children Unlimited, and I know that's on the, you're on the virtual.
Yes. Hi, my name is Barbara Campbell, and can you hear me okay?
Yes, we can.
Okay, thank you. I'm board president for Children Unlimited, and this year we're asking for level funding from the town of Wolfeboro for the Family Connections Resource Center. And the Resource Center holds the sole state contract for comprehensive family support services in Carroll County. So the contract mandates that we provide services to any family who has a child up to 21 years of age, and that's a place for families to go for parent education, support, skill building, empowerment, resources, and referrals to gain access to other community resources. We promote family strengthening and a strong sense of community, overall helping children to succeed. The services are provided through classes as well as individual and family support, and we collaborate with other agencies, but there is no duplication of our services. We are one of 11 resource centers in the state of New Hampshire. We see families in many of the other towns in Carroll County, and again, we're requesting level funding. We were very proud also to say that we were able to completely continue our services through COVID, which was challenging, but was met. So we have really appreciated the support from Wolfeboro in the past and hope that you'll support our request for level funding this year again.
Okay. Any board members have any questions or concerns? Hearing none, I want to thank you for your work you do with the children of the area, and thank you for coming tonight.
You're welcome. Thank you so much as well.
Is there any agency that I have passed over? Hearing none, we have Northern Human Services and CASA are the two that didn't show up tonight. We'll need to get back to them. Okay. Next item on the agenda is other business. Anybody, any board members have any other business? Hearing none, I'm not going to do any committee reports tonight. We usually do those at our board meetings. Town manager, you have anything to report out tonight, or do you want to wait until another meeting?
I have nothing to report out at this point.
Okay. Press, is there anybody from the press here? I don't see that. Any public input? Well, they look like they've all left. Can I have a motion to go into non-public session?
So moved.
Second.
Any further discussion? All those in favor, say aye. Aye. Opposed? We're in non-public.